Everyone, my name is Caitlin Lynch and I am Dynamic Behavior Partners. I created Dynamic Behavior Partners as a accumulation of the last 10 years of my life working in special education. My job role spanned from being an intervention specialist in the classroom setting to an administration role as an associate principal. And now I serve as a consultant to both school settings as well as in home and with families, anywhere from academic support, behavioral support, IEP, team meetings, the whole gambit. But I partnered with Homegrown Alliance as I wanted to be able to support our community and sharing the information and experience I have when it comes to special education, and really making sure that families feel supported and they feel like they have enough information going into these meetings, because even being in the field for 10 years, 10 plus years, it's a lot. There's a lot of different lingo, there's a lot of different processes and paperwork and forms. And so over the next 5 sessions, I wanted to be able to share what knowledge I have, and just be here as a person that the community can come to, ask questions, and see how I can support however possible. But I'm really grateful for Homegrown Alliance for supporting me and kind of helping me be a voice and getting this information out. So today during this video, this is all of session 1. So I wanted to kind of get it recorded so we can get that information out there. And then at the end of the video, I have some information about when our next session is. But without further ado, welcome to part 1, where the goal is for the entire 5 sessions is that we're turning all of those questions into confidence, and being able to get you guys all the information that you need. So session 1 is all about decoding the alphabet soup. So as I had mentioned, even being in the field as long as I have, there is a lot of acronyms. Sometimes I even forget what they are. And later on in different sessions, when we start talking about different types of assessments, different types of paperwork, I could provide a whole dictionary of vocabulary. So the goal of today is to kind of be able to look at the different types of educational paths a student may take, from kindergarten to when they graduate, or to further diploma in a transition program, and all the different lingo that might come into that. Being able to, hey, how do I know what my student needs? What are some of the signs that they may need some extra support? And then when I see that, how do I take action on my concerns? And then kind of just a brief start of how to navigate the referral process to requesting services or extra support for your child. So the first one we'll tackle is talking about placement paths and the lingo. I always kind of make the joke, if you're familiar with chicka chicka boom boom, everybody's running up to the coconut tree, mamas and papas, uncles and aunts, hug their little dears and dust their pants. Um, it is very much so the whole alphabet. We have different acronyms: ETR, IEP, PBIS, the list goes on. And so it can feel very much like you are running up a tree before everything comes crashing down on you, of just everything going on. But to break it down, the easiest way is trying to look at it as it's a continuum. And so, as you're moving forward with more support, or what's called the least restrictive environment, so meeting the environmental needs that your student may have, whether that be more restrictive down here towards the end versus least restrictive, which is more of the general education classroom setting. It is truly could be a back and forth continuum. So even though you may move forward, you could, the next year your child and student may be able to go a different path. It should be a constant conversation based off of progress and data and a lot of other different factors. So, starting out in just the general education classroom, that is just a student who may not be receiving any types of services. This is, you go into the classroom, you learn from your teacher, you go home at the end of the day. The next step up from that is you start recognizing, or your child's teacher may start recognizing that they need a little bit more support. That could be done through 504 plans, RTI, which is response to intervention, and we'll kind of dive into that next. Or it could be looking at an inclusion or push-in style. But that is essentially looking at general education, but with maybe some additional accommodations, or maybe some small groups, either with the teacher, maybe a classroom volunteer. Like this previous year, I was able to spend some time in my daughter's classroom just doing some reading groups with some kiddos. The next is pull out services. So that may be a student being removed from the classroom for a set of time to either maybe meet with a therapeutic intervention, speech and language, occupational therapy, physical therapy, the school counselor, mental health therapist, or receiving specialized services with an intervention specialist. The next step up is looking at more specialized classrooms. So that is where a student may be completely removed from that general education classroom and they're in what's called a self-contained setting. Now, that self-contained setting does not mean that they are in that room all day, every day. And I'll kind of go over that too. But it is a more intensive support for a majority of their day. The next placement, and these last couple may not be things that are super common, but they are definitely available if the needs and the data support that. There are specialized programs to support a range of needs. So this will look like a student being removed from the school district building and attending school in a specialized program. There's a variety of different ones in the area. The next one is students who may need to access their curriculum and education at home via home instruction. That is somewhat separate from homeschool, where a family may be using an online curriculum or curriculum on their own. The home instruction piece is truly that they are receiving specialized services still from the school district, but then the school district may be providing either remote learning or learning from somebody coming into the home. That also may look like, receiving a day service as well. And then the last one is looking at restrictive environments. So this may be supporting education while they're getting care. This may be an inpatient treatment where they have mental health services, where it's a day treatment program. This may look like a student who may need to receive educational services as part of the juvenile detention center, a variety of different things. So first, kind of diving into general education. So when a school teacher, it does not matter what grade they go into, when they are receiving their training, we are all trained on the Universal Design of Learning, or UDL. And every child, no matter what their needs, these are the things that are expected of teachers to do and provide. So that could be whole group and small group instruction. We are, based off of research-based curriculum. So every state has, kind of their own handpicked curriculum. Sometimes schools may have stuff as well, but it's all research-based, so that you know that it's been tested, and staff are trained on it. We also may be looking at social emotional learning. So it could be somebody getting, curriculum about character strengths or positive behavior, becoming role models, and kind of more looking at the social emotional pieces. Parent teacher conferences, you should be updated on how your child is doing through report cards, meeting with the teacher. and then district-wide and statewide assessments. All students go through different types of assessments throughout the year. I pulled this exactly from the Little Miami School District webpage. So feel free to pause it. It's also online. But these are just a list of kind of different assessments that your child may take throughout their entire 12 plus years in the school system. And again, some school districts use different curriculum or different testing. And then there's some of these that are brought down by the state. And we'll, not during this session, but a future session, we'll kind of talk about what these different assessments look for and what information you can pull from them. The next is looking at general education with accommodation. So this is where I mentioned if a student may need some additional support or accommodation through a 504 plan. They may need response to intervention, which is that multi-tier support service. They're maybe looking at, yes, they definitely are going to need that small group setting in order to reteach a skill. Could be where they're sitting in the classroom. It could be if there is maybe a physical need for students that may be, hard of hearing, vision. This also could look like a general education being taught with an intervention specialist coming into the classroom. When we're looking at services outside of the classroom, these could be where a child may need to be pulled out for any given amount of time. It may be daily, it may be once a week, it may be once a month. The minutes are kind of, it varies and it's based off of that child's individual needs. But if we're looking at, could be English language learning services, when I was speaking of the response to intervention, you have your first tier, which is tier 1, and that's in the classroom. But then if a student still shows that they need more support, they're going to move up to tier 2 and then tier 3. If that continues to need support. This could be your different types of therapy services, OT, speech, physical therapy. Or if a child has qualified for an IEP or an individualized education program plan, then they may be pulled out just to receive specialized services on their goals that you decide as a team with an intervention specialist. And that sometimes is in either maybe in a small group in a hallway pod or the resource room. Now, looking at the self-contained setting, so this may be a student accessing a majority of their day in that resource room. But again, as I had mentioned, this may not mean that they're in there all day. So when you're looking at, a student's IEP, and again, we'll go over this too later on, there are different types of categories. So this would be what's called an IE15. And that just means that they're out of a regular class or general education class for more than 60% of their day. Again, a lot of districts I've seen do things differently, but often they are accessing a lot of their daily routine math and reading in that self-contained setting, but then may go to electives courses, specials, gym, art, and then sometimes that also includes science and social studies. And then this is also where you're going to start seeing maybe some more adult shared support and where we start seeing more paraprofessionals or one-to-one aides assisting our students in those different classrooms. And then the last couple, as I mentioned, are these more restrictive settings, or where they may not, their least restrictive environment and what's going to be most supportive for them may not be in the school district at all. There are a lot of different programs based around, the Cincinnati, Warren County area. And there's other programs that are even out of state that I know some families have attempted to try. So Ultimately, when it's coming up with, well, why would a student, or how does that team decide, if the student can be served in the school district, or if they need more support, that is going to be the school district's decision as an IEP team, with you involved, the family involved. As you dive into learning more about the free and appropriate public education, or FAPE, this is the responsibility of the school district. If the school district and the IEP team, make that team decision that no, this student, the least restrictive environment and more support is needed, then they will support you in providing, support financially, transportation to get that student to that alternate program. But then there's also, in the state of Ohio, there's different types of Ed Choice scholarships. So there's the John Peterson Scholarship, the Autism Scholarship. There are different types of things that you can do, kind of all over. But these are just little pockets of money that can support you financially. But the downside to that is that sometimes taking that Ed Choice scholarship and a family finding their own placement, that might be, the student signing away, or the family signing away free and public education. And I'll go into that later too. And again, this also may be intensive inpatient services, day treatment centers, juvenile detention centers, or home instruction, or even virtual school services. Okay, so now kind of diving into talking about, okay, I see a need for my child. Can I, how do I take action, and how do I get my child support? So the first, different areas that you may need, or kind of see some red flags or some things that are concerning, if your child is bringing home their classwork, their grades, their report cards, you're sitting down with them doing homework, and, you're noticing that they're really struggling either with the academic piece, the emotional piece of that, some of that work, different things that they may be talking about during the school day. There are a variety of different things that I even sit down with my own kiddo. She's going into second grade, and I'm just like, oh dear. So I talked a lot, very extensively with her teacher last year, especially about a lot of her reading and the concerns we have there. But so again, some of those indicators could be academic, behavioral, emotional. Maybe if you have talked with your medical provider during checkups, and there's maybe some physical or developmental concerns, or any type of complex health needs. If your child is diagnosed with something medically, or different things that may come up throughout their life. So when you're thinking about those concerns, hopefully it is not just you that are recognizing those concerns, and maybe the teachers in the school is also recognizing those. I know that big committees within the school-based systems, they're constantly looking at a lot of the testing information from those assessments I showed you. And they're constantly kind of looking over teachers' grades, and the progress that students are making, and constantly diving into data to make sure that they're supporting their students the best that they can. So when that comes into thinking about, okay, hey, I'm recognizing, the teacher's recognizing that the student needs some more support in reading. So that may be, looking at different types of instruction, that small group setting, but they're probably going to have some extra progress monitoring to make sure that they are able to kind of catch up, or showing growth with those more intensive services in the classroom. Or, okay, we're still seeing a lot of struggling. I think we need to get, more support. So oftentimes you're going to see RTI as a based off of the triangle of support. And you're going to see this a lot where, you're looking at, a lot of students will be successful with that tier one intervention in the classroom, but then, it's going to get more intensive. And it's also going to become a lot more specialized and individualized as they move up to different tiers. So what that looks like is kind of a cycle. So they're going to start out in tier one, where we're seeing just some concerns. Let's try to do some extra practice and decoding skills for reading or math or handwriting. We're going to do some, small group instruction. Maybe it might be at the beginning of the day, during reading centers. They're going to continue to progress monitor to see if they are able to catch up on those skills. They're still struggling. Let's move up to tier two. That might be that pull out where they're working in a small group or one-to-one with somebody. Again, they're going to be continuing that progress monitoring. And then they're going to be continuously assessing, is the student making progress or do they need even more support? So areas that can include is reading. So it may be looking at phonics, fluency, vocabulary, comprehension, writing, math, and then even a lot of different social and emotional things. So it could be where a student's receiving response to intervention or RTI and behavior, and they may have what's called a check-in and check-out system where they have a point sheet every day or a smiley face, and they can be working towards different positive goals, maybe spending time with the guidance counselor or the teacher or earning different things while they're working on learning and strengthening positive classroom behaviors. It could be social skills, small groups as well. But there's a lot of even, social, emotional, behavioral things that are also taking place, not just the academics. And typically, schools are not legally required to tell you if your child is receiving any type of RTI services. Now, best practices are that they include parents in that information, especially if the student is needing to be in that tier two or tier three support. But you definitely, it's free game to be able to keep asking and checking in, especially if you start seeing some of those red flags, as I had mentioned, where your child is bringing home grades or homework and you're seeing, that there's skill deficits or really a lot of emotional distress about a certain topic or subject. Hey, I just wanted to see, is there extra support being provided already at school? What can I do to support him at home? And then if you do get that information that they're receiving RTI services, you are free to also ask for, okay, hey, what is the plan? What is the timeline? How often are you progress monitoring? What's the data look like? When are you going to make the next decision if they need more support? And getting a lot more updates and specific progress information. And then I'm not going to read through all of this, but again, this is also from the Little Miami District website. There is a process called Child Find. And essentially what that looks at as, they're taking that response to intervention data or different things that may be popping up that shows that a student is going to need more individualized support and may need to go through the eligibility process to receive an IEP or that individualized education plan. So, hey, we're going to be looking at a variety of different things and then going from there, what that child will need in order to be successful in that least restrictive environment. Okay, so kind of, tying a lot of these different processes in. Okay, I've recognized that my student is struggling and showing, a lot of need in this specific area, or maybe something has come up as far as medical or developmental concerns, and I just know that they need more support. I need more support as a parent. How do I navigate that? How do I get the ball rolling if the school has not, kind of come to you first? When you put in for an initial referral, and I will also have an example to provide for this, it's often being provided a letter to the school district, maybe the school principal, your teacher, but you can write a letter at any time that you feel that you have concerns to initiate a referral or an evaluation. And then again, I'll give an example, but it could be, hey, due to these concerns, I feel that my child needs more support. It is affecting, these parts of their academic or, everyday life. I would like to pull together a evaluation team to start that process. The initial evaluation, what the goal of is that they are conducting a very comprehensive assessment by the school team, often led by the school psychologist. And then, based off of all of that data that's going to be pulled together in this process, they're going to determine if a student is eligible for special education services. So that evaluation is to identify whether that student has a qualifying disability, determine the impact of that disability on the student's educational performance, and accessing the general education, not even the curriculum, the building, their peers, behaviorally, emotionally, the whole child, not just their academics. And then determine what level, if they do need support, that can be at different, the best way to describe it is different prescriptions, or different levels. So one child may need more intensive services in reading and not any in math, where the next child may need, some additional support in math, but maybe not in reading. When I say qualifying disabilities, so this is outlined in the IDEA. That is a national criteria. So these are the following categories that are determined as eligibility disabilities. So autism, deaf and blindness, just deafness, hearing impairment, visual impairment, emotional behavioral disturbance or EBD, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment or OHI, specific learning disabilities or SLD, speech and language impairment, or traumatic brain injury or TBI. So who is on this evaluation team? So I had already mentioned that typically it's led by the school psychologist, and then obviously family and parents are involved as well. And then they will often bring in the child's general education teacher, and they may need to bring in other specialists if they have been already attempting to do, response to intervention. They may bring in those individuals, the school principal or the assistant principal, a variety of different people who support your child throughout the day. You can, request this in writing, and then you can also maybe get additional information if there are different types of referrals from your doctor related to a recent medical diagnosis. So the federal, again, IDEA guidelines is that once a parent, provides the referral, the school or the request for evaluation, the school is going to act on that pretty immediately. Before they can begin any evaluation, they are going to get your consent. It's a written consent. This is also going to take place during an evaluation planning meeting. So they will go over a document, and that's actually our next one, the next session, but they'll go over this document. They'll talk about all the different areas or the different types of assessments that, hey, based off of the current need, based off of the current data, we believe that your child will benefit from getting information from this assessment. This is how this assessment will go, who will do this assessment, when will it happen. All of that information should be shared with you during that evaluation planning meeting. And then within 60 days of receiving that referral, they have to be reaching out to you. But hopefully, again, best practice is that they're doing that sooner. So different things that they could assess just because it is on this list or on the document, the planning form, does that mean that it has to happen? You are in the driver's seat, so they should be able to explain everything of what the different tests are. The next session, I'll be kind of going over some frequent ones that at least I have had experience with and that I see often. But you should be able to, based off of data and what you know of your child and their needs, be able to request or deny any and all of these assessments. So sometimes they'll do the cognitive ability, an IQ test. They'll look at the students' academic achievements from a lot of their classroom. There's also a different types of more intensive academic assessments they can do with them. They may pull information from the speech and language pathologist for communication and language. They may look at social emotional information and data. They may pull in motor skills, fine, that gross motor, more physical, big physical movements. They're going to request health and medical history from you, different things about their developmental milestones as they've gotten older. And then they often will complete observations in the school setting. You as a parent, during this entire process, I always make sure to have families that information well before the meeting so that you have time to read it. Depending on how many different assessments are needed, and the different pieces that are going into the ETR, you may be getting a pretty thick report. And again, I've been in this field a really long time, and sometimes a lot of the different assessments that I'm not super familiar with, I still have to go through with a fine tooth comb and kind of maybe Google or ask questions. Hey, what does this one mean again? Or what does this section mean again? So there's a lot of information, and you have every right to be able to read through that before the meeting. Make sure if you have not been able to read through the ETR, you get to the meeting, they're kind of, read through everything with you. And sometimes they may not go super in depth during those meetings. You have the right to request additional time to continue to review before signing. And then you also have the right to disagree with the findings, and you can request an independent evaluation. And sometimes in certain situations that would be at the school's expense, or sometimes that is you requesting an outside evaluation, and that is somebody that you find and that you pay for. So it is a case by case basis, but it does happen. And then you also have the parental right to participate in any meetings and sign off or denying signing before anything is kind of moved on as far as eligibility and services go. Okay, so I know that was a lot of information. The goal is that when you see this video, it should be posted with some other information, like a link to ask any questions from this session of any of the topics. It will also hopefully include the link and registration for our session 2, which you see here. And we're going to be talking a lot more in depth about that referral and evaluation process, and what the ETR is going to or could look like, just based off of, a lot of the different things that are available to families and school districts right now as part of that. So our next session, session 2, will be next Thursday, July 10th, from 7 to 8 p.m. The goal is that because this is virtual, people will be able and families will be able to log in and just sit and listen. Cameras do not have to be on. I don't mind. I've been in education. I tell people all the time, I taught during COVID, so I got very used to staring at my camera myself. So whatever is the easiest way for you to be able to access the information. But again, I hope that you were able to pull out something new or something that, may have been confusing to you. Again, there will be a link to ask questions. Please, feel free to reach out. My Facebook through Homegrown, or my own Facebook page, whatever you need to do. But I thank you for, listening through. And I hope that we were able to kind of go over some information that was helpful. But thanks again for listening to session 1. And I hope to see you during session 2. Bye.